Hello and welcome. I'm Katrina Pratt Roebuck, founder and CEO of Uplifme. And Uplifme is a national resource hub of resource events happening across the country that address the social drivers of health. Uplifme also highlights the wonderful work of organizations serving their communities every day. So today I have with me Dr. Janine Lisitski, who is the Chief Executive Officer for Mental Health Partnerships. So Janine, welcome and thank you so much for being here.
Thank you, Katrina. I'm happy to be on with you today.
Great. So can you start by telling us what your organization does and who you serve?
Yes, so Mental Health Partnerships is almost 75 years old now, and we started as a grassroots advocacy group of people with mental health challenges who got together because there wasn't community-based support to create a meaningful life in the community. And part of what we worked on early on was deinstitutionalization and really pushing for the resources needed for people to thrive in their communities. And we saw so many great wins over the years with the closure of the Philadelphia State Hospital, with the bringing up health choices and even community behavioral health as part of the answer to those community supports. And today we serve about over 10,000 people a year through
Wow.
not only advocacy still, and training, but also direct services. And we provide a range of services from recovery learning centers, which are a drop-in center where
Okay.
people can build community towards recovery and get a whole range of services, to street outreach and case management, certified peer specialist services, some residential programs, and even representative payee services. So
Okay.
really support people in being empowered to take control of their finances.
That's fantastic. How can people access your services?
They can either go onto our website and call us, or they can use our chat line. There's a chat line we have to connect people to support and services. They can use that. They can be referred by a whole variety of community organizations, medical or social service or otherwise. And they can also access our services directly from our drop-in centers. We have 4 recovery learning centers, and we can help people get connected.
Okay. And so if someone does not have insurance, are they eligible to receive services? Can they self-refer? Can you talk a little bit about that?
Yes, we at our recovery learning centers, you don't need to have insurance, so you can
Okay.
start accessing there. And then in order to get our certified peer specialists and case management and other things, you do need insurance, or you may need a referral from the county. So we can help you through that, but there's always a free starting place, and that's either a
Okay.
recovery learning center or
Mhm.
online, our chat line. We can start with you there and even help people to get the insurance they need. We work with people to get connected to benefits, which I know is a service that's disappearing in our
Right.
community. So I hope people will take advantage of that.
So that's really wonderful. So you are able to basically have people come and receive services at whatever point or stage they find themselves, right? So whether they have insurance or not, whether they need help to connect to the resources to get additional services. So I think that's really helpful. Can you talk a little bit about, you mentioned before that the work of mental health partnerships started from advocacy and people wanting to be in community with each other. Can you talk a little bit about how that looks today within mental health partnerships?
I can. Recently, we kind of brought back up our advocacy committee,
Okay.
and that is staff, its participants, its community stakeholders, all together hearing the experiences of folks and identifying what are the priorities that we're really going to work together to achieve. Recently, there was another example where we had an advocacy workshop at one of our
Hmm.
recovery learning centers.
Okay.
And the questions were, based on your experience as a participant and your lived story, like, what are the barriers to getting
Mhm,
what you need from the system, whether
mhm,
that's policy barriers, or other things. And we heard so many great stories, and
mhm.
what emerged from that was a lot of priorities we could work on. And we also brought in a city council person to
Okay.
that event at the very end to hear directly from participants. So I think all of that helped the participants to understand that their voice can be
Mhm,
powerful, uh,
mhm.
and together that we can work on some of those things that are barriers to mental well-being.
Okay, so I think it's really important that you all are able to provide this platform, this regular opportunity for voices to be heard. So just wanted to ask you a little bit about the CPS training that you all do. Can you talk a little bit about that, what the CPS training is, and how many people you provide the certification to annually?
Yes, we are providing training for not only Philadelphia County, but multiple counties in Pennsylvania. We're one of only 3 trainers in the state for
Hmm.
certified peer specialists. It's a 2-week training course every day, so it's quite
Oh,
in.
okay.
And there's a whole cohort, could be up to 30 people who are
Mhm,
taking the course together, and they're being equipped to understand how to support people in recovery with various tools like the wellness recovery action plan,
mhm,
other tools, and they're learning so that they can actually start providing services within medical assistance, covered by medical assistance through different counties, and get out there and really help other people walk through that journey of recovery together because they have lived experience. And
yeah.
we find that that is so powerful. Like, we have a homeless specialty, and
Mhm,
what we find is people experiencing homelessness who work with the CPS are much less likely to fall back into homelessness because they have that safety net of
mhm,
support,
mhm.
from someone they can always talk to, who they can relate to,
Yeah.
um, to help disentangle some of the barriers that people run into.
Yeah, and I don't think it could be overstated how important the work of certified peer specialists are, to your point around really providing that safety net and also being able to be relatable to folks because they have lived experience, and just how powerful that connection could be and help someone in their journey. I don't think that could be overstated. So thank you for sharing all of that. I'd like to know if perhaps there's something that the public doesn't know about mental health partnerships that you'd like them to know.
I think earlier I shared what we were just such a strong advocate and
Mhm,
pioneer throughout many decades of,
mhm.
getting to a point where we have certified peer specialists now in the system. And one thing that we're working on that I'm really excited about is trying to create a much stronger career pathway for
Okay.
people who then become CPSs. Well, where do they go from there? Because a CPS is a relatively low paying job in the system, because of the way it's funded. And so, what is the career pathway? How can we
Mhm.
get more people with lived experience into various different areas of the mental health workforce? Not only CPS, but case managers, therapists, even
Sure.
psychiatrists and leaders. How do we develop leaders in our field? So that's something that we're starting work on, and we want to make a lot more robust as we go into the next couple of years.
I think that's great. I'm glad to hear that you all are working on that. I think that the CPS role as an on-ramp into behavioral health jobs is an important one. And so really appreciate that you all are thinking about how to expand that and give folks additional opportunities. So can you talk a little bit about perhaps something you are looking forward to accomplishing in the coming year?
In addition to what I just talked about, which was our Peer and Power Path program that's new, we're also looking to work with corporations on
Okay.
workplace wellness, but
Okay.
something a little more significant than only mental health training or technical assistance on policies and other workplace wellness initiatives. We want to help develop cohorts within corporations of peer specialists. So we would
Mm,
go in corporations and recruit people with lived experience there, train them as certified peer specialists, have them delivering those services to their colleagues a certain number of hours a week and continue their regular job. And then mental health partnerships would support them ongoing, so they don't have to disclose to the HR team. And I
mm.
believe this is a way of really changing cultures in corporate
Yeah,
America,
absolutely.
and also expanding the number of workers who take advantage of employee assistance programs, which right now we know it's really low. But if we had that kind of service in-house, how would that change overall the mental well-being of all people? And
Yeah,
that is our goal.
that's powerful. That's huge, I think. And can you talk a little bit, and I don't think I asked you this question in the beginning, what is the geographic reach of mental health partnerships?
Mental health partnerships is serving southeastern Pennsylvania.
Okay,
Right now we're in 5 counties,
okay,
although, we want to look at where there's a gap and a need, and we could go to other counties in our region. We're in Chester, Bucks, Montgomery,
mhm,
Delaware, and Philadelphia counties now.
okay, okay. Well, I'm looking
Our
forward.
largest footprint is in Philadelphia and Delaware counties.
Okay, okay. Well, I'm looking forward to hearing more about both the CPS expanded roles as well as putting people into the corporate sector and really sort of, to your point, allowing people to see the benefits of taking advantage of EAP services. I think that that's going to be huge. And so happy that you were able to share that with us today. I'm excited. So, can you also tell us before we go how folks would be able to either volunteer or donate to your organization?
Yes, the easiest way is to go to our website, which is
Mm,
mhphope.org. Together we build hope.
mhm.
And they can go, and there's a page for donations. There's also a page for volunteering, and there's a quick form for volunteering, which lays out all of the opportunities available. One, which is
Okay.
really interesting, folks from Chester County, we have a Compeer program where we have volunteer friends who we connect with people with mental health conditions who then stay together and literally
Mm,
become like family. It's extremely transformational from what we hear from all of our participants, but that's a unique volunteer opportunity, but there's a lot of others as well. So
okay.
go on and learn more about mental health partnerships and how you can join together in building hope and a future in the community for people with mental health challenges.
So we will put this information in the notes so people can come directly to those pages and support your organization. And it's been really wonderful to learn more about mental health partnerships. So thank you, Janine, for spending this time together.
Thank you so much, Katrina. Have a great day.
You do the same.